So welcome to Substance Use Prevention. It's good for business. Thank you all again for joining us this afternoon. We are going to take the next hour to look at a toolkit that has been developed over the last year by the Minnesota Department of Health and the Minnesota Business Partnership. They've worked together to create this tool that's called the Opioid Epidemic Response Employer Toolkit. It was designed for employers and has 5 concrete actions that employers can take to be part of the opioid epidemic response. And what's unique about it is that employers can customize all of the materials as it's appropriate for their particular workplace. So today we're going to hear from presenters representing the Minnesota Department of Health and also the Minnesota Business Partnership for them to further explain the steps in the toolkit. You're going to leave the webinar knowing the contents of that toolkit and where to access it, like I said. And also we hope that you leave with some practical ideas for how that toolkit can be used in the workplace. We're going to be, most of our time is going to be spent in a demonstration which will hopefully illustrate some of those practical uses for these materials. Finally, we hope that you'll leave with some tips for engaging local employers as champions for substance use and misuse prevention and recovery. I'm going to have our presenters introduce themselves briefly so you know who you're hearing from. So Allison, let's start with you.
Like I mentioned, I'm Allison Molitor, Drug Overdose Communications Coordinator here at the Minnesota Department of Health. Much of my work is on the MDH Opioid Dashboard, which is where this employer toolkit is housed. We like to call it a one-stop shop for opioid-related data and information. So on it, you'll find data and resources on the opioid epidemic in Minnesota, including information on opioid overdose deaths, non-fatal opioid overdoses, use, misuse, and substance use disorder, prescribing practices, supply diversion and harm reduction, co-occurring conditions, and social determinants of health. So you can see it's pretty comprehensive. This is part of the Data-Driven Prevention Initiative, or DDPI, which is funded by the Centers for Disease Control and Prevention.
And I'm Lucas Nessie, Director of Health Policy for the Minnesota Business Partnership. The Minnesota Business Partnership is a membership organization that consists of more than 120 CEOs and senior executives from Minnesota's largest employers, so employers like Target, Cargill, Blue Cross, Blue Shield of Minnesota, and more. I'm really proud to be part of this today because whether businesses know it or not, their employees are impacted by substance use disorder.
Hi everyone, I'm Kate Erickson. I'm the Opioid Overdose Prevention Director for the Minnesota Department of Health. And today you're mostly going to be hearing from Allison and Lucas, but I helped to create the employer toolkit, and so I'm here for questions at the end.
Excellent. Thank you to the 3 of you. We're super excited to have you and to have you share all of this with our audience today. Again, I am Lindsay Smith. I'm the Project Director for the Minnesota Prevention Resource Center, who's hosting today's webinar. So I'll be serving in the capacity of moderator, which means that I am responsible for the housekeeping stuff and the administrative stuff. So the issue we were having earlier with the phone line, I've been working on that. A couple other things to draw your attention to. If you need help with something, if you're having a technical glitch of your own, there is a hand raise button like on so many webinar platforms. If you will just click that, and that will indicate to me that you need something, and I will respond to you with a direct chat. There are also going to be 2 ways to interact with us today. There are going to be some chat box questions. So every time you see this blue kind of talk icon, that's an indicator that we will be asking you to weigh in on a chat question. Also, there will be a couple of polls. So when we get to that point, keep your eye out for that. We'd love you to participate in our polls this afternoon as well. finally, this webinar is being recorded, so if you're interested in viewing it again or sharing it with a colleague, the recording will be uploaded to the Minnesota Prevention Resource Center website by next week, and you can find it at that link. I wanted to share just a little bit of additional background before I leave it to our presenters to take us away with the main part of today's webinar. We chose this topic for a few reasons. First, we know that it's a pretty common struggle for those of you who are working in community, doing that grassroots organizing, community organizing work around substance abuse and misuse prevention. We know it can be a common struggle to engage businesses and employers in your community as a champion. Many of you are asked to do that or are thinking that that would be beneficial to your cause, and so we wanted to have today's session in part be about giving you new ideas or answering some of your questions about how to engage that particular sector of your community differently. The toolkit itself, which you're going to see demonstrated in just a minute, has a number of what we're referring to as kind of plug-and-play tools. So these tools were created to be easy for you to use and will hopefully give you an easy starting point and something that you can bring to employers in your community that you can offer to them as opposed to coming right in with an ask of them, right? And finally, we're hoping that it gives you some new inspiration for employer engagement in your community, new ideas for how that might look. And we want to make sure that it's clear that while this particular toolkit was created with the opioid epidemic response in mind, that we hope you'll think about other ways to apply it to some of the things that you're working on or additional things that you're working on in your community. I've shared the direct link to the toolkit here as well. Everybody that is on the webinar today will receive the slides, so you'll have the direct link available to you there so you can check it out after we're done today. With that, I am going to have Allison and Lucas start our demonstration. I'm going to share the desktop, have Allison share her desktop so that she can get started on that and walk us through the toolkit. Allison, would you go ahead and click share and then select your desktop?
Sure thing. Okay, is everyone able to see the screen?
You got it.
Great. So like Lindsay mentioned, today Lucas and I are going to walk you through the toolkit. In this webinar, I'm going to be playing the role of the champion of the toolkit, and Lucas will be playing the role of a business who's implementing it. To emphasize, this is only a role play. The Minnesota Business Partnership members are leaders in the business community who are at the forefront of responding to the opioid epidemic. Okay, let's get started. Good afternoon, Lucas. Thank you so much for your willingness to take a look at how your company can be supportive to its employees in addressing substance use. I'm excited to show you the Opioid Epidemic Response Employer Toolkit. In it, you'll find tweets, emails, and flyers that you can customize for your team. I'm interested. What motivated you to learn more about how you can help your employees?
Well, frankly, as an employer, I hadn't really thought about substance use disorder as it relates to my employees. But we have been concerned as of late about how some of our employees have gotten in maybe more accidents, missed work, or their increased turnover. I could see how substance use disorder might be contributing to this. And of course, we're always eager to learn more about how we can help our employees. We want our employees to be happy. We want to help them. We want to treat our employees well. We want to know what we can do. We're starting to see signs that we've certainly heard about in the opioid epidemic in the news. We want to make sure that we're making resources available to our employees.
You're certainly not alone in that. Many employers are struggling with workplace safety, healthcare costs, productivity, and absenteeism due to substance use disorders. Not only are employees themselves affected by substance use disorder and its associated harms, but we recognize that any employee could have a partner, child, family member, or friend struggling with a substance use disorder as well. In your mind, what's the best possible outcome of us working together on this effort?
Well, I'm not sure what's possible. I just know that between opioids and other drugs, substance use disorder is affecting our workplace in many ways. Now, it's certainly not my area of expertise, but I know there must be something we can do.
There absolutely is. We spend a lot of time at work. Employers have the unique opportunity to encourage prevention, identify the early signs and symptoms of a substance use disorder, connect employees to treatment and recovery supports, and be a prevention and recovery-friendly environment. The nice thing about this toolkit is that you don't have to be an expert. Are you ready to dive in and take a look at the tools?
You bet. Let's get started.
Sure. This first topic here is called Change the Conversation. Substance use disorder is a preventable and treatable illness. So many of us are aware of the consequences and harms associated with substance use disorder. We talked about a few of those here already. What many people don't know is that there are actual cost savings associated with prevention and recovery. Compared to the general population, people in recovery miss fewer days of work, have lower healthcare utilization, and stay at their jobs longer. Further still, preventing the development of a substance use disorder in the first place prevents businesses from being impacted by the previously mentioned consequences and harms of substance use disorders. We really want employers to understand that prevention and recovery are good for business. There's a 3-minute video here that talks about how opioids impact our brains. And if you want, we can watch just a quick part of it.
Yeah, excuse me. I think stigma is a big issue. That's a great place to start to change the conversation about what addiction is. By opening up conversations about mental health and addiction, the employees will become more comfortable about talking about it. We can promote positive mental health and prevent substance use disorders. I became familiar with the stigma around substance use disorder through the Make It Okay campaign, a mental health initiative designed to reduce stigma through education about how to be supportive of people experiencing mental illness. So can we watch the video?
Absolutely.
Of unintentional overdoses from the use of opioids that are dying from car accidents in the United States.
Silence equals death. We don't want to discuss this in our family living rooms. We don't want to discuss it in our communities and in this nation.
With my son Brian took his life out of feeling there was something wrong with his character. Why couldn't he not use?
There's a genetic predisposition to developing an opioid addiction.
Good homes, bad homes, you're just lucky if you get by without it.
The brain gets hijacked. No one can think or pray or believe themselves out of what the brain is telling them, even though it's very...
Okay, so what are your initial thoughts after seeing that video?
Well, that definitely highlights the issues. It really highlights that some of the behaviors often associated with substance use disorder are actually part of the disease. I think that video can serve as a tool to open up the conversation around substance use disorder and help break the stigma within my employee.
You're exactly right. It can be tough to talk about substance use disorder, but we hope these resources provide a good place to start. We've also provided 2 tweets that you can post on your company's Twitter account to show that you support your employees. Let's take a look at those. You can see that they further emphasize the importance of opening up a conversation about substance use disorder.
Nice, and I see that I can edit them there. And I could edit these for other social media platforms too. I'm starting to see that opening up a conversation is an important and easy first step to addressing stigma.
There's also an email template you can use. The email goes a bit more in-depth about the importance of talking about substance use disorder. Did you know that only 1 in 10 people with a substance use disorder gets treatment?
Wow, I had no idea, and that's unfortunate. As an employer, I email my employees all the time. This is a simple step that I know I can have a big positive impact with my employees on.
Absolutely. Stigma is one of the biggest barriers that prevents people from getting the treatment they need. This email I mentioned also includes guidance on the power of language that we use when talking about substance use disorder. Terms like addict and substance abuse can negatively affect how we view people with substance use disorders. So the recommendation now is to use what we call person-first language to promote positive mental health. That means instead of saying addict, we would say person with a substance use disorder. For people working in healthcare, you might hear the terms dirty and clean used in reference to toxicology reports. Now, the preferred language is to instead talk about it as someone is actively using a controlled substance, or that their urine toxicology was positive for a particular substance.
That makes total sense to me. I think as an employer, we could start implementing that sort of culture change in our workplace. I can email HR right now and have them edit our documents. Language is important for fostering an environment where everyone feels understood and supported.
Awesome. That's great that you're seeing ways you can act right away. Sometimes this topic can feel overwhelming, and the Employer Toolkit is meant to break it down into concrete actions you can take.
Great. I'm going to pause our demonstration for just a moment to open up a poll related to what Lucas and Allison are working on right now. So what we'd like to hear from all of you is, what types of communication do employers in your workplace or workplaces in your area, what types of communications do you think employees pay most attention to? Email, signs in the break room, mail at the office, etc. You see the list there. What we're interested in is if there are some other ways that you might take some of this information that's available in the toolkit, as Allison and Lucas just demonstrated, and maybe apply it to some other areas as well. I see some results coming in. So if you'll take just another couple seconds and submit your response, I'll close the poll in maybe another 10 seconds. Okay, great. We have about half of you with an answer. Okay. So I am going to close the poll and share the results with everyone. So like you see here, it looks like a lot of you think employees in workplaces in your area definitely pay attention to email. So that's great. I think that will definitely be a good use of these tools that are available to you. And as well as social media and also some intranet postings seem to be highest, maybe signs in the break room. So again, I encourage you all to, as you continue to listen to our demonstration, to think about how some of these pre-written messages and tools that are available for communicating to employees might be used for some of those other areas or some of those other applications that you think employees will pay most attention to. With that, Allison, if you will reshare your screen, we'll jump back into the demonstration. Thanks, everybody.
Okay, thanks everyone. So back on the toolkit, we watched the video, took a look at these tweets, and checked out the email. Now, let's check out this calculator called The Real Cost of Substance Use in Your Workplace. You can see here that it asks you to choose your industry, the state your facilities are located in, and number of employees in your organization. Let's use manufacturing as an example here. Then you enter your email address, and the site will send you a report to your email. So I'll enter my email address down here. Your company is primarily in the manufacturing sector. So how many employees work in manufacturing in Minnesota?
I know that there are about 300,000 employees in Minnesota classified as working in manufacturing.
Okay, so I'll enter that here. and then I entered my email already. So then once we click Get Your Report, it'll pull up the results and send a copy of the report to your email. So what the report shows is that the total cost of substance use disorders here at the very top is $102 million in lost time, employee turnover, and healthcare utilization. If you scroll down, like we talked about, you will actually see that there are cost savings associated with prevention and recovery. As we also previously talked about, only 1 in 10 people get treatment for substance use disorder. The slider here shows that if only 1 in 10 people in your company who had a substance use disorder received help, you would save $8 million. Think about if everyone who needed help received it. So you can see that by clicking here on the slider, that's 100%. Your company would save $76 million. Add that in with the cost savings of prevention, and we're talking about a huge difference. The report also shows the prevalence of substance use disorder by industry. So for manufacturing, there is an average prevalence. It also gives an estimate of how many people in your company are likely affected. Based on national statistics, there would be 25,200 employees who are personally impacted by substance use disorder, and an additional 48,601 who have a loved one with a substance use disorder and are impacted.
I had no idea how broad this was and that the costs were so high. That makes a real impact on our budget. This is definitely something our workplace could benefit from addressing right away. By doing so, we would really be helping our employees.
You're absolutely right. Investing in prevention and recovery can go a long ways. So back on the toolkit, you can see that anytime we're done with a section, you just click on the bar here again, and it collapses back to its original position. Let's collapse this one and move on to the next section. This one is called Promote Safe Use, Storage, and Disposal. We know that sometimes people hold on to medications just in case. It's important for people to know that it is illegal and not safe for a person to share medications with anyone other than the person for which the medications were prescribed. Medicines in our homes are the second leading cause of accidental poisonings in children and adults. So the recommendation is to safely dispose of any unused or expired medications.
So what are the action steps I could take here?
Well, you can see we have 2 tweets that you can choose from about safe disposal locations in Minnesota for your prescriptions. Minnesota has approximately 240 drop boxes where you can safely dispose of your medications. Then you can see when we click the link here, we can find a site hosted by the Minnesota Pollution Control Agency. They have a statewide searchable site where you can find safe Dropbox locations. So what's your zip code?
55108.
Okay, so we'll enter that here. We'll click St. Paul. When we enter 55108, it pulls up all the locations that are close by. The locations are at sheriff's offices, police stations, and pharmacies. In your case, I see 6 locations within 5 miles of your zip code. If you click on each location, you can see more details about the site.
That's really helpful. I had no idea there were so many safe Dropbox locations near me. There's one literally around the corner. I can definitely pass this along to the employees. I want them to know how easy and convenient it is for them to drop these off. This is something all of our employees could do to protect themselves and their families.
That's the goal. Pollution Control has really made it easy to use their tool and find Dropbox locations. Now, back on the toolkit, you'll see another flyer template that you can customize about safe disposal sites. It's important to remember when using the tool that in more rural areas, there will probably be fewer options for safe disposal, and in urban areas, there tend to be more. So you can list the specific locations, or you can list the link to find the locations. And here's that flyer that I mentioned. That might be a good option to hang up in a break room or somewhere around the office. Okay, now let's take a look at the email too. It focuses on all of the aspects of this section: safe use, safe storage, and safe disposal. It walks you through safe use using the acronym BRAIN. Anytime patients are faced with potentially being prescribed an opioid, This is an acronym they can remember that encourages them to be an active participant in their healthcare decision-making and ask questions about their care. They can use this to have a conversation with their provider about taking opioids. The middle part of the email talks about safe storage. The recommendation is to keep medications out of reach of children and pets, keep them locked up, and get rid of unused medications. This also has the number for Minnesota Poison Control. We recommend saving this number in case of any accidental poisoning. The last part of the email shows the searchable database that we just walked through together. You are welcome to further explore the additional background information here about safe use.
This is all really great, and like the other section, I see that I can edit and personalize it for my employees. But what can my employees do if they or someone they know is at risk of or experience an opioid overdose emergency?
That's a great question. We were just about to discuss that in the third section here, which is called Prepare for Overdose Emergencies. This section focuses on naloxone, a medication that blocks the effects of opioids during an opioid overdose emergency, and on the role that pharmacies can play in preventing overdoses.
I've heard about naloxone before, but let's say employees have it on hand. How do they learn to use it?
That's another great question. In this bottom section here, you'll see 7 informational videos about naloxone covering topics like what it is, who needs it, where to get it, how to store it, how long it lasts, signs and symptoms of an overdose, and how to help someone who is overdosing. You'll also see here the names of 3 community-based organizations that provide training at no cost on how to use your naloxone kit. As part of the training, everyone walks away with a free naloxone kit, and participants have the opportunity to practice administering naloxone. The names of the organizations are Steve Rumler Hope Network, Rural AIDS Action Network, and Valhalla Meridian. With the flyer in this section, you can either advertise an upcoming training they are hosting, or you can work with them to host a training for your employees. There is also some information about Minnesota's opioid prescribing guidelines, which promote prescribing opioids in a safe and thoughtful manner, along with information about the active role that pharmacies can take in preventing overdoses. Even though you're not in a clinical setting, there are pharmacies in your area that can help.
I'm sure pharmacies can really play a role in providing support. Can we watch one of those videos right now?
Sure. Let's click on this one called What Do I Do When Someone Overdoses on Opioids?
So the first thing you want to do when you have determined that a person is not responding to that pain response is you want to call 911. Immediately do that. Act fast, go get your phone, call right away. The next step you're going to take is you're going to get your naloxone. When you get your naloxone, then the next thing you're going to do is immediately give 2 rescue drugs. You're going to then administer the naloxone. It doesn't matter if you have the intramuscular naloxone or the nasal naloxone or the auto-injector. They are all the same. It's just a different way of administering it, but it all works equally well. Then the next thing you do is continue to give rescue breaths until help arrives or 2 minutes have gone by. If help has not arrived, if your first responders have not arrived, and 2 minutes have gone by, you're going to give a second dose.
Okay, what thoughts do you have after watching that video?
Well, that sure shows the important steps to take when someone is overdosing. I see that the details about naloxone and providing it are covered in the trainings we mentioned. I see the 4th section is called Make Help Accessible. I think it's important for my employees to know what effective treatments are available for them. Where do they find that out?
Now there is a statewide treatment locator for mental health and substance use disorders resources. Let's take a look at it together. It's called the Fast Tracker. And so once we pull it up here, we'll go over to substance use disorder on the right side. And sometimes it can take a while to load. So it's important to remember that, even if it's not loading right away, it still is working. So sometimes we just have to give it a second.
Sure. Well, I'm still thinking about the naloxone training and that we have a staff meeting coming up soon. I'm going to see if we can get someone to come to that.
Great. So the great part about the Fast Tracker is that you can search on different keywords that are relevant to the type of treatment a person is seeking, like buprenorphine or culturally specific services, LGBTQ services, or pregnant or maternal services. And so you can see on the site, you would look for your keywords here at the top, and it gives you a drop-down list there. Once you enter your search terms, results will come up showing facilities with treatment openings.
I can see how all of that is really valuable information. The first step to getting help is knowing where to find it.
Absolutely. Looking back at the toolkit, it's important to note another valuable resource. If an employer identifies an employee or a family member who is in need of help, they can call the back of their insurance card to inquire about resources to pass along, use their employee assistance program, and/or use the fast tracker to explore treatment options.
If you had to suggest a first step, what's one action step I can start with for this topic?
Great question. Here's a simple tweet you can post on your company's Twitter account. Recovery is possible. Find available substance use disorder treatment on the Fast Tracker, a statewide searchable database. And then you can see that it provides a link there. So it's also important to know that the Fast Tracker was released at the end of 2017 by the Department of Human Services. So it's still a relatively new tool that not everyone knows about yet. The last section here is called Support Wellness. All employees can benefit from a workplace that focuses on health and wellness, and especially if an employee is in recovery, there are additional considerations to take into account. A survey conducted by the National Safety Council found that 65% of human resources decision makers believe that substance use disorder was a justifiable reason to fire someone. It's important to know, though, maintaining employment in a recovery-friendly environment is an important part of the recovery journey. For example, if your company hosts events or get-togethers, are some or all of those substance-free? The recovery journey is unique for each person. In this section, there's a tweet you can send out about making sure that sick days are about all kinds of wellness, a flyer about hosting a health and wellness brown bag lunch discussion, and lastly, some questions for a listening session to learn from employees who are in recovery about what is needed to truly be a recovery-friendly workplace. And remember, prevention and recovery from substance use disorder go hand in hand. Many of the previously mentioned efforts to support recovery can also support a prevention-focused workplace.
This is a relief. You know, I'm not an expert in substance use disorder, but clearly this is impacting all employees. I think it's just so important for people to realize that they don't need to know everything to do something. Obviously, it also goes without being said that if an employee were to come to us for help with a substance use disorder, they can expect to have their privacy respected and not fear negative consequences like discrimination or legal action. It's great that this is broken down into 5 concrete steps that I can easily roll out within my company.
Definitely. Well, Lucas, it sounds like you're well on your way to creating a prevention and recovery supportive workplace. If you have any additional questions about how to implement this with your employees, you can always reach out to us here at MDH, and we're happy to help. Feel free to contact me at allison.molitor@state.mn.us.
Excellent. And that ends our demonstration for the webinar. Thank you so much to Allison and Lucas. We hope that that illustrated all of or many of the tools in the toolkit. We're interested to get your initial feedback on how you think this series of tools will be received in your community. So I've just opened up our second poll. If you would take a moment and answer or rate from strongly agree to strongly disagree or not applicable. The question is, I think employers in my community will be responsive to or interested in these tools. So let us know how much you agree with that. We're just, again, curious initially as to how you think these things will be received. I'm curious, Lucas or Allison or Kate, how they've been received in some of the companies that this has been implemented in already. Is there a good quick case example?
A quick case example would be the construction industry. We run a health policy committee, which is co-chaired by the CEO of API Group, which is a large general contracting firm, and he's been able to implement it within his own industry. And then what's great about this is exactly what we're seeing today is we share it with one group who then shares it with their network, and it keeps going from there. So Russ Becker was able to take it to a construction industry forum, which then shared it with 1,000 people there who then take it back. And at some point you lose track of where this is going, but you're just happy that it's going somewhere. Yeah,
definitely. That's great. All right, so a good number of you have participated. The majority have, so I'm going to display the results and close the poll. Happy to see that a majority of you feel employers will, or agree that employers will be responsive to or interested in these tools. So we definitely hope that, again, these tools are a starting point for you in some conversations with employers in your area. We'd also love for you to take a minute and respond in the chat box to this question. Do a little reflection on what you've heard. Think about what is one action you'll take in the next month for employer engagement. It can be a simple step using something you heard about in the toolkit. It can be something bigger or maybe a new idea that's come up. While you're thinking on that, we are going to have Lucas, from his perspective, again with Minnesota Business Partnership, have Lucas share some tips that he's been mulling over a little bit for us as to how you all can engage employers as a prevention champion. When Lucas and I talked about this when we met a few weeks ago, some things that we were thinking that you all might be wondering is how from a big business perspective can coalition organizers or public health professionals or others engage employers in these efforts, and maybe even what are some common mistakes that people make in trying to engage businesses?
Sure. I think I'll start with what I hope is reflected within this toolkit. You'll see that we tried to make it as simple and as concrete and non-controversial as possible. A lot of what the challenge I think you'll run into in trying to get employers to share this with their employees is them being uncomfortable with moving forward with something that they don't know a lot about. So we tried to remove a lot of that the complex areas of this and just make it as simple as forwarding concrete information that's been vetted and is very simple to interpret. So getting them to be comfortable with sharing that broadly is going to be the biggest challenge. And I think as you work to find the right person in your network to share this, the mistake that some people might make is recognize that person in the business will then have to go back and talk to many other people within that business to get some clearance before they start advocating for this as part of their broader brand. So recognize that might take some time. And my recommendation for you to make them, to get them to that level of comfort is find examples where other groups have done this. Maybe instead, as you approach people with this, bring the article from the Star Tribune that talks about all the different business leaders that are already engaged in this. Say here's how they're implementing this. Here's been the reaction. You can do these simple things as well, and know that it's already happened, and it's not going out on a limb here. This is easy steps that we can take.
Great. Yeah, that's a great idea of giving examples of other companies that have engaged in this. So for everybody on the line, I will follow up with Lucas and or Kate and Allison and get that article and share it with everybody that was on today's webinar. That's a great additional resource. Lucas, what advice do you have for engaging smaller or local businesses? A lot of the businesses you mentioned are a part of Minnesota Business Partnership or some of the larger companies in Minnesota. I imagine that many of the folks on the line today are in rural areas or might be interested in engaging some local businesses. Do you have advice for those folks or ways that they might apply some of what you're talking about to that setting?
Sure. I think large business or small business, it's always going to be about finding the right person that's able to latch onto this and move it forward within the company. So you'll probably be able to figure that out right away. And I would always encourage you, as you reach out to, say, the HR person, or maybe there's a one person does all, you end it with, and if you're not the right person for this request, please let me know who that might be. That way it doesn't drop off and they're prompted to respond with I'll pass this along, yes, I am the right person, or this is the right person to talk to. So there's always some sort of interaction to keep it moving forward.
Mm-hmm. Great. Are there in your experience, particular staff that are a good kind of first step or like foot in the door? Typically, would it be HR? Would it be kind of what department or what type of position should people be making that first outreach to?
Sure. I think typically it would be the HR person, but obviously if you're able to find someone who attended a conference on anything remotely related to this, you would start with that person and then rope it back in. Finding any connection within what you see those companies currently engaged in is a great way to hone in your approach to that company.
Sure, great point. So it's also about paying attention to what those companies' priorities are or kind of what they are looking at. So it's about, like with all other coalition work, right, it's about paying attention to what people are interested in already and using that as an inroad. That's great. So I am taking a look at the chat box. Thank you all so much for sharing what it is that you're thinking about. This is great stuff. We have people thinking about, as a next step, adding the poison control number to the county's Dropbox, prescription drug Dropbox web page as a next step. Sharing these tools with a member of the Rotary, bringing information to worksite wellness committees that maybe you're already a part of or participating in, sharing the resources and information with a workplace wellness cohort, similar concept, sharing the toolkit on social media, a lot of sharing with worksite wellness collaboratives. So that's excellent. So for folks that aren't already connected to a worksite wellness collaborative, that might be a different inroad to consider. Sharing the toolkit with leadership, sharing with local coalition, talking to the local Chamber of Commerce about promoting these tools to their members. That sounds like a great connection. Lucas, do you have anything additional to say about connecting with chambers and how that might look to promote some of this stuff?
The Statewide Chamber of Commerce is very engaged on this as well, and I believe they're formally considering sending it out to their local chambers statewide.
Oh, fantastic. So presumably in the near future, that will be a conversation that's already being had among chambers, and so it'll be familiar. So if someone from public health or from a coalition did kind of that follow-up to maybe offer more context, that would be something they were at least already familiar with. That's great. Let's see what else we have. Some folks, it sounds like on their coalition, already have someone who's representing the business sector on their coalition. So maybe a first step is to sit with them, walk through all of the items in the toolkit, and see what they think of that. there's a comment about the calculator that was shown would really open people's eyes to the financial losses as well as the savings for prevention and intervention efforts, which the cost savings really is a big message of that tool. They make a very specific point of looking at that positive element of it, and so that's great that you're seeing that. And then also working with other retail co-ops, sharing with the media is also a next step. So lots of really great ideas. I hope that everybody who's seeing everything come through in the chat, you're taking ideas from one another also. I know there's already been a little bit of networking within the group chat. So again, that too is really fantastic. So thank you for all of that really great input. We want to open up just generally, if anybody has additional questions, we promised that we would open it up for general Q&A. At the very beginning, I posed a question in the chat box about what people were hoping to learn. So while you all are thinking of other questions that you might have, place them in the chat box. I'll start with what people were hoping to learn and maybe review if we've tackled those things. One person was interested. Oh, go ahead.
Lindsay, this is Kate. I just wanted to make a couple comments while questions are coming in.
Sure.
One, back to how to engage employees or employers is obviously if you know of a champion, if you know of a champion provider within a clinical system, you start with that person and ask them, who else should I be talking to? Or like Lucas said, if somebody's shown up to a community event that's about substance use disorder prevention, finding out who they work for and how to share this tool. And what Allison and Lucas were demonstrating today is really that interaction where you say, can I pop over for lunch sometime and show you this cool tool that's available and free and walk you through it and then see what, if anything, you could use? And so it's really, going face-to-face with somebody, sitting side by side, opening your computer, and just walking through the toolkit and saying, what do you think? What, if anything, in this would you use? And then the other piece about engaging the businesses is what I found is that people care for different reasons. And really figuring out what is motivating the employer and running with that. So if it's about safety and preventing injury, run with that. If it's about retention and preventing turnover, run with that. If it's about being a supportive workplace and being a part of the solution and that heartstring part, run with that. The other thing I want to mention about the tool, the calculator, is that sometimes when you start to talk about the costs of substance use disorder in terms of accidents, missed work, turnover, healthcare utilization, et cetera, an unintentional consequence of that is it can actually be that it increases stigma towards substance use disorder because it starts to imply that it's a liability to employ people who have a chronic condition like substance use disorder. And so to ensure that you are pairing that information, if you are ever talking about the cost of substance use disorder, you are also talking about the cost savings of recovery. Obviously, investing in people's wellness and long-term recovery is good for business, and it's better to retain employees for the long haul.
Definitely.
And the piece from our perspective at MDH is we have the opioid dashboard, and it's trying to be this one-stop shop for tools and resources related to the opioid epidemic, and we have so many good things in Minnesota. We have the Fast Tracker from DHS. We have the Safe Disposal Locator from Pollution Control Agency. We have the Naloxone protocol from MDH and the Board of Pharmacy. But all these tools are only as good as they are being used and implemented in communities. And so making sure that people know about the tools and are using them on the ground.
Definitely, yes. All really, really important. Thank you for that, Kate. Very helpful. We have received one question so far. Lynette says, no large employers in my area. How can this be used by small businesses, those with fewer than 30 employees? we talked a little bit about application for small business, but do any of our presenters have anything additional to answer Lynn's question?
I would say that might even be a benefit because they're smaller and they're probably literally able to get everyone in the whole company in for a lunch or just a regular meeting. So I would say it might even be easier to be able to target a small group like that. And small companies in rural areas are probably even more so engaged in the local community in some aspects, so that has that added benefit as well.
Excellent. Great. If there are other questions from our audience, feel free to put them in the chat.
And Lindsay, this is Allison. I just wanted to add in really quick. We actually have a short URL for the toolkit, so you don't have to remember the long one.
It's perfect.
Yeah, and I'll also email that to you so you can include it with the slides. But it's health.state.mn.us/opioid toolkit.
Perfect. Much easier than the one that I shared earlier. Thank you, Allison.
And I see Chris's comment about costs are important, but having healthy, productive employees is very important too. And we couldn't agree more. And this effort was born out of a health initiative, and that's just an extra benefit that we've added in to kind of round out all the different benefits from engaging on this issue.
Yeah, absolutely. Chris goes on to say employees who are concerned about a loved one's substance abuse can also creates a distracted employee. So again, all reasons, or employers may want to review their benefits package too to ensure good care. So yes, again, it's all of these arguments about thinking through all of the different ways that employees benefit from preventative services and recovery is all a great conversation to have.
Yep, this is Kate again, and I wanted to say about the small employees, about policies needing to be updated and things like that. So as Allison talked about, there was that study that was done that the National Safety Council said that 65% of human resources decision makers believe that substance use disorder was a justifiable reason to terminate somebody from employment. And it's important to note where things are at, the baseline, and then where we can get to. And so especially that last part of the toolkit, the supporting wellness part and becoming a recovery-friendly workplace, it's really about opening up that conversation and saying, what could you be doing? What might you be able to do differently? So for example, saying, if somebody goes through the application and interview process and you have selected them as a final candidate and then they don't pass a drug test, what happens? What are the steps that roll out? What, if anything, could you be doing differently about that process? So at the National RX and Heroin Summit, there was a company that talked about how they had changed their process, where a drug test that came out positive for substances wasn't a closed door. It was feedback was given that if you go through an assessment and any treatment or recovery that results from that assessment, come on back and apply again. We're excited to have you here. And that the drug showing up on the drug test didn't necessarily mean that the door was closed. And then same thing once you already have employees is, how is substance use disorder talked about? And obviously if an employer sends out a message that says, did you know that there's a statewide treatment locator for substance use disorder? Explore this for yourself or loved ones. That already sends the message that this is something that you can talk about here. This is a place where you don't have to suffer in silence.
Yep. All right. Well, thank you, Kate, for those final comments. And thank you to Allison and Lucas for your great information, great insight, your tips. I hope that everyone has taken away what they were hoping to get out of today, or at least a starting point for some of what you're hoping to do in engaging businesses in your community. Before we wrap, I wanted to leave you with just a couple of additional resources to know about from the system of services for folks that are working in prevention, like all of you on the line. If you haven't already met your regional prevention coordinator, these are 7 people who are local to your area who can help you think about what next steps might be. So those of you who are thinking about reaching out to your Chamber of Commerce, those of you who are thinking about using this toolkit as a way in, or haven't been inspired with some new idea today, if you're looking for someone to brainstorm that with, your regional prevention coordinator is one of the people that you can do that with, in addition to the folks who presented today. So we wanted to make sure that you got connected or know about these folks. Their website is on the slide. They're one provider in addition to Minnesota Prevention Resource Center, which I work on that project. These are all funded by Department of Human Services Behavioral Health Division. And Minnesota Prevention Resource Center, one of our primary functions is to host learning opportunities like today. And so if you're interested in joining us for more opportunities to learn, develop your professional knowledge, or your knowledge related to substance abuse prevention, you can join us for more by going to the link you see on the slide. We have another webinar that's actually in partnership with Minnesota Department of Health again, coming up February 26th. It's called Uncovering Health Disparities, Racial Equity and Substance Use Prevention in Minnesota. We also have 2 ongoing core prevention trainings. One is Substance Abuse Prevention Skills. Then the next one will be in March, but that actually is full. So the next open course will be this summer in Bemidji. And we also host an Ethics and Prevention training, which looks at the topic of ethics, but from a prevention professional lens and the ethical dilemmas that we face in this particular work. So that's coming up here in Bloomington in March, and then also in Bemidji this summer. We also encourage you to save the date for the 2019 Minnesota Prevention Program Sharing Conference. It's going to be in Duluth this year, October 24th and 25th. Registration is going to open later this spring, but we encourage you to save the date for that. If you want to read more about the conference, you can visit that page of our website and read details from last year, get kind of a sense of the flavor of what that event is all about. And with that, I again thank all of our presenters and thank the audience for tuning in today. Again, the recording will be available on our website next week. And we hope you have a wonderful rest of the afternoon. For all of you who are, well, I think you all are in Minnesota or near neighboring states, stay warm. It's a very cold day today. And we look forward to having you on the next one. So thank you, everybody.